Hi everyone, how are you doing? Hope you a great day. So guys, before going through this video, I will be asking you for subscribing my channel. Since indeed you will be liking this video, since it's going to be a great video, please share, comment, and if you haven't turned on the bell yet, please do it. So okay, let's go. So guys, today the topic is going to be related to the concept of CHD, the coronary heart disease. So, coronary arteries, what are they? So because first let's go through the fundamental informations in order to reach the concept of CHD, that specific disease, which is going to refer on coronary arteries. What are they? So I think we talked about arteries before in our last video, so we can easily encounter with these kind of stuffs. Coronary arteries are those tiny vessels that are found on the heart, which can be considered as the most crucial artery in the body. So don't forget this. They can be considered as the most crucial artery in the body. This artery supplies the heart with enough oxygen, water, and different kinds of nutrients, which defines that this artery encourages the heart to relax and contract properly. So as you can see, the heart is the base form of the circulatory system. So it can be the most crucial part of our body. So when there is a vessel or there is an artery for supplying the heart, so it can be named, it can be well known as the most crucial artery in the body. And as you can see in the picture, there are coronary arteries on the heart, not inside the heart. Don't forget this. Some teenagers, some IGCSE students, they have some problems in this concept that they are saying that coronary arteries are beside those chambers and they are inside the heart. But this is completely incorrect. The arteries, those coronary arteries, are placed on the heart. So, a brief introduction to CHD, the coronary heart disease. Whenever a person uses up a huge amount of saturated fat regularly, not once, regularly, like for example twice a week, all the times, a lot, some layers in form of plaques will build up through the inner wall of our coronary arteries that causes the passage of the blood to be blocked. So it prevents the passage of the blood, the oxygenated blood indeed. So in that case, the heart is not going to be able to become well supplied, and also the heart cannot be able to relax and contract properly, which might cause a heart attack. So as you can see in these pictures, some plaques, some kind of fatty deposits, they built up through those coronary arteries, which prevents the passage of the oxygenated blood through our coronary arteries. So, causes and treatments of CHD. So first let's talk about the causes of CHD. What causes this disease to occur, let's say? Stress, it can be sometimes. The most common ones, obesity and diet. And also genes, like in this case, while I'm saying genes, like there are some people based on their DNA, based on their genes, they will die because of CHD. While they are not eating that much fat, they are not eating that much saturated fat, but they are having CHD and they are dying for this, which is really bad. And also smoking, it can be really bad. So there is a tip here for the treatments of CHD, which there is nothing that people can do for encouraging the CHD to be cured. But there are a couple of treatments which are really effective in this process. That means it's not like, okay, use this, you are going to be okay, for example. It's nothing like this about the treatments of CHD. Nothing can encourage the CHD to be cured. But there are some meditations that they can be used by the people that can be really effective in this process. So, the first one is the statins, which it reduces the level of cholesterol in the blood, in those coronary arteries, and also the low dose aspirin, which it reduces the blood clotting, lowering the risk of heart attack. There is a tip here that most of the IGCSE students have problems in it. That when I'm saying this reduces the blood clotting, I don't mean by the concept when the skin is rounded. I don't mean by this. I mean when the blood doesn't flow properly. That means blood clotting is going to be formed by two ways. First, it is when the skin is rounded and the scab formation happens, which is exactly something else. And when the blood doesn't flow properly, it can be another cause about it. And the coronary bypass surgery. This surgery can be used for eliminating the CHD process. That means, yeah, I'm saying that there is no meditations about it, but there can be some surgeries that can be used for eliminating this process, for not letting the CHD and as a result, the heart attack to happen, to occur. In this surgery, the surgeons will be taking an artery from another part of the body, usually from the leg, and then connecting it throughout that blocked artery. Therefore, it creates a graft, as you can see in the picture, that can bypass the blocked artery, so that oxygenated blood can be transported by that specific artery, which is going to be usually taken from the leg. So in this case, those oxygenated bloods, they are not going to be carried from those coronary arteries. They are going to be carried by that specific artery which was taken by the leg, from the leg. It's really simple. And the second type of surgery, which is named as angioplasty and the stent placement surgery. So, in this surgery, the surgeons are willing to reduce the thickness of those plaques, of those fatty deposits that they built up in the coronary arteries. So they will put a deflated balloon. Don't forget this. They will put a deflated balloon inside that artery. And then, indeed, they will inflate it, which compresses the fatty deposits, or let's say those plaques that they built up through those coronary arteries, against the artery walls. So the thickness of those fatty deposits decreases time by time while that balloon is being inflated. From this moment onwards, the surgeons are done with the surgery, but in this case, so this might come to your mind, so Ilya, why did you use stent placement? Why did you write stent placement? So what is it? You talked about only angioplasty, so what is stent placement? I'm saying this, that from that moment onwards, the surgeons are completely done with the surgery, but in order to ensure that fatty deposit is not going to increase its thickness again, that means if the amount of those fatty deposits was more than which is expected, they will also place a stent inside that artery so they can ensure that those plaques are not going to become thick anymore. As you can see in the picture, in the left picture, we are only talking about the process of angioplasty. As you can see, that balloon is only going to be used, which first it is deflated, and as you can see, those fatty deposits, the thickness of those fatty deposits, or let's say those plaques, is really high. But after that balloon is going to be inflated, it compresses the fatty deposits, or let's say those plaques, against, don't forget this, against the artery inner walls. So guys, we are done. So hope you a great day and see you in our next video.